Welcome. This is Interactive Imaging TV and part 2 of our discussion with Dr. Dale Miles, and we're talking about X-ray dosage reduction. Dr. Miles, welcome back. Can you explain selection criteria in the dental X-ray process?
Sure. Selection criteria was a concept, or is a concept, of basically examining the patient to determine the need for the radiographic procedure before actually ordering it, like a test, like blood work. Selection criteria has been around a long time. I can provide you with a table that the ADA and the FDA have produced to show new patient exam, recall patient, whatever. But selection criteria basically, again, is one of those concepts that's been taught for years, but most dentists really don't pay much attention to. Dentists don't take their own x-rays. They delegate the procedure, the acquisition of the image, if you will, to a dental assistant or a dental hygienist. So it's kind of out of sight, out of mind. And that's kind of unfortunate because, if I were a good lawyer, I almost hate to bring this up, if you don't examine a patient prior to determining the need for those radiographs, and then your assistant or hygienist takes those x-rays on a patient, you haven't informed them, you haven't examined them. X-rays cause harm. A good lawyer will say, well, could x-rays cause cancer or cause harm? And you say yes, and all of a sudden it's, well, doctor, you just committed battery. So again, I said I hated to bring that up, but dentists must be examining their patients prior to doing any x-ray procedure and then requesting or ordering their assistant or staff member to actually acquire only those images that are necessary for the patient examination.
Can you talk about some of the factors that determine whether or not an X-ray procedure is appropriate?
Well, factors would include number, type, and frequency. For instance, if I'm just looking for cavities, bite wing X-rays are basically the standard. If I'm looking at a patient who's in acute pain and a swollen gum because a tooth pulp died, then I want to have what we call a periapical image. So lots of scenarios present themselves. There's no shortage of reasons for taking radiographs. We need them for diagnosis. You pretty well take radiographs on every patient that walks in your office, but you're determining the need. Another example would be the panoramic image. If you're trying to determine growth and development, you got a 9-year-old boy or girl in the chair, and you want to see where the successor teeth are. A panoramic image, digital panoramic especially, is only very, very low exposure, 5 to 10 microsieverts, and we get 3,600 microsieverts every year. So you could take one image, you could see all the teeth, not only the ones that are present, but the ones that are on their way, the adult teeth that are going to replace the baby teeth. So that is what we mean by selection criteria. Every situation is different. It is a prescription. It is ordering a test called a radiograph or an image to support your suspicion or help you make a clinical decision.
My guest has been Dr. Dale Miles. This is Interactive Imaging TV.